Let's talk about the urinary system. The urinary system performs many functions. It gets rid of the waste that builds up in metabolism, it balances our salts, and it regulates acid-base balance, and it regulates fluid balance through the concentration and dilution of urine. But as we age, there are some changes that take place in the urinary system, both in structure and function. As we age, less urine can be stored in the bladder, so geriatric patients may have to urinate more frequently than others. The lower urinary system is highly muscular, and aging causes this muscle to lose strength and tone. An increase in bladder contractions can also cause frequent urination. The glomerular filtration rate decreases in older patients, which means that the kidneys are less efficient in filtering waste and medications. And this is going to affect the dosages that we give older patients. If they can't filter it in the same way that younger people can, it can lead to a buildup of that medication in their body. So we want to avoid that. With the ability to concentrate urine decreased, older adults are unable to deal with changes in fluid volume as effectively as young people. The ability to maintain acid-base balance can also decrease, and that can lead to some major complications as well. As you know, we've talked about acid-base balance a lot. When assessing older patients, there are some differences that you may notice. The kidneys are going to be less palpable, and this is because there's less renal tissue to be felt. Creatinine clearance will decrease while BUN and serum creatinine will increase, and this is because there's a reduction of nephrons and renal blood vessels that are supplying the kidney. There's a decrease in function of the loop of Henle. This can cause nocturia, less concentrated urine, and again can alter that drug elimination. In the lower urinary tract, the bladder may be palpable after urination, and this is because there could be some urine retention. So there's still urine in the bladder because the patient was unable to void completely. Incontinence may occur, and that's because of a weakening of muscle tone that we talked about. There can be a decreased bladder capacity, which can lead to frequency, urgency, nocturia. In women, there's going to be decreased estrogen after menopause. This can lead to an overactive bladder as well as painful urination or dysuria. For men, the enlarged prostate can cause hesitancy, straining, and dribbling. The pathophysiology in relation to older adults. There is a greater chance for our patients to run into urinary problems and disorders with age. We will just look at a few of those on these slides. First, urolithiasis, otherwise known as kidney stones. Patients may have slower urine flow as they age. Genetic predisposition and diet may also contribute to this condition, to the formation of stones. And this can be extremely painful, so we need to make sure that we take their complaints of pain seriously for people with kidney stones and that we don't undertreat them for pain. There's benign prostatic hyperplasia. This is an enlarged prostate. So the exact cause is unknown, but it's believed that the hormones in aging men have something to do with it. Basically, the prostate pushes on the urethra as it gets larger, which doesn't allow the normal passage of urine through the urethra. These patients may frequently urinate small amounts, but will have a harder time voiding completely due to the pressure on their urethra. Renal failure. So there's a few different causes of renal failure. One is a loss of intravascular fluid, so there's less blood going to the kidneys. And this can be caused by a few things. Mostly dehydration is a big cause of the loss of intravascular fluid. patients may either have limited access to water, or maybe they don't like that they have to urinate so frequently, so they limit their water themselves. Infection is another way to cause renal failure. It can cause a lot of damage to the kidneys, and as can nephrotoxic medications. And benign prostatic hyperplasia, which is again an enlarged prostate, and we talked about that earlier. This can get so bad and so inflamed that it actually backs up urine into the kidney and can cause renal failure that way. Bladder cancer. It's more common in people over 50 and much more common in men than it is in women, and that risk is higher, even higher, for those who've been exposed to carcinogens. So that could be in the workplace, being exposed to harsh chemicals, or that could be from smoking. And I wanted to talk for a minute about UTIs because that's something that we come into contact with a lot as nurses. So this occurs because of the processes that we talked about earlier. That's urinary retention, decreased estrogen, strokes, and of course, indwelling urinary catheters are huge factors that increase the prevalence of UTIs. So some typical symptoms of a urinary tract infection are dysuria, fever, and flake pain, but this may or may not be present in your older patient. Another thing that you should look for is confusion. So if there's some new onset confusion with your patient, this is something to suspect. I also wanted to talk about incontinence, as that is another prevalent issue with our older patients. So there are 4 kinds of incontinence. Stress incontinence is you're laughing and sneezing that causes urine to leak out. So anything that increases intra-abdominal pressure is going to cause the urine to leak out. And this is because of the weakened muscle tone that we talked about. So these are the muscles of the pelvic floor that just don't have the same tone that they used to, and so the urine will leak out. There's urge incontinence. Patient with urge incontinence will feel the urge, but will not be able to make it to the bathroom before they urinate. This can be due to a UTI, an enlarged prostate, tumors, or a stroke. Then there's reflex incontinence, and this is going to be your neurological damage. So the patient doesn't feel the sensation, the urge sensation, and urine leaks out. Then there's overflow incontinence, and that's what we talked about with our BPH. The prostate is going to close up around the urethra and cause only small amounts of urine to leak frequently from a full bladder. So educating our patients on healthy bladder habits is super important. Doing this can help prevent or reduce urinary symptoms. We need to encourage them to drink at least 8 glasses of water before 8 p.m. because if they do it after 8 p.m., that can lead to some frequent urination in the night. We want to make sure that they're limiting the use of sleeping pills as well as alcohol, because these can decrease bladder sensation, and that's not good. We want them to limit cola, tea, and coffee, as these can all increase urination. And we want to really remind them to not ignore the urge to urinate. They need to urinate when they feel it. Seeking medical attention for urinary problems is really important because our patients can be kind of embarrassed about it. This is a pretty sensitive topic, and it's important that they seek help, because burning, pain, blood in the urine, and incontinence aren't just normal parts of aging. We need to be really understanding of these problems and just help them when they're feeling embarrassed about it. So education is a huge part of how to help with these urinary symptoms.